So osteoporosis, it is a reduced bone density causing the microarchitectural deterioration of the bone tissue and increases the risk of fracture. It increases with age. Bone density declines with age, and it is especially seen in women. The most common sites: forearm, spine and hip. The most serious one is the hip fracture. Spine vertebral fracture of the spine and collis fracture is more common on forearm. And the immediate mortality rate is about 12%. But the pathophysiology part, normally the bone mass increases during the skeletal growth, and it reaches a peak at between 20 and 40 years and then falls. Like during the menopause, due to estrogen deficiency, there will be an accelerated phase of bone loss. And this peak bone mass and bone loss are both regulated by genetic and environmental factors. Exercise, calcium intake during the growth and adolescence are important in maximizing the peak bone mass and regulating the rates of postmenopausal bone loss. And now the important causes are smoking, alcohol consumption, and estrogen deficiency in postmenopausal women. And early menopause, that is below 45, is an important risk factor. It is less common in men. And like in secondary causes like hypogonadism, corticosteroid use and alcoholism and all, it is seen in men also. So in secondary causes, we said hypogonadism, corticosteroid, alcoholism and all. In corticosteroid use, what happens? This corticosteroid have an inhibitory effect on the osteoblast function. Okay, the steroids will inhibit the calcium absorption, intestinal calcium absorption. So this calcium will be excreted through urine. Renal leakage of calcium will be there. So the calcium reduces, and secondary hyperparathyroidism will occur, compensatory. And this will cause increased osteoclastic bone resorption. Okay, and pregnancy associated also occurs. It is rare, and there will be back pain, multiple vertebral fractures during second and third trimester. The endocrine causes are mainly hypogonadism, hyperthyroidism, hyperparathyroidism, Cushing syndrome and all. And the inflammatory causes IBD, ankylosing spondylitis and RA and all. And steroids, antiepileptics and also can cause osteoporosis. Then malabsorption and chronic liver disease, myeloma, homocystinuria, anorexia nervosa. And in athletes, HIV patients, Gaucher's disease, systemic mastocytosis, immobilization, poor diet with low body weight and all will be there. And white women more than 50 years of age, white or Asians, sedentary lifestyle, alcohol and tobacco use are also more prone to this disease. The diagnosis is mainly by DEXA scan. The T-score is being checked. T-score means the measurement of standard deviation relative to average healthy adults in their 20s. Okay. For osteoporosis, T-score of minus 2.5 or less. T-score of like between minus 1 and minus 2.5 is osteopenia. Less than 2.5 is osteoporosis. Between minus 1 and minus 2.5 is osteopenia. Now osteomalacia, it is a disorder of bone mineralization. The bone matrix is intact. T-score of an average healthy adult is 0 in 20s. So in both osteoporosis and osteopenia, mineralization and bone matrix is decreased. Treatment is by bisphosphonates. This T-score is commonly asked question. And the risk factors are age greater than 50 as the bone density decreases, postmenopausal, early menopausal or nulliparity. In this condition, the estrogen level decreases and it favors the osteoclastic activity. Thin built, sedentary lifestyle, and whites are more prone than blacks, and secondary osteoporosis like drugs and steroids and all, and deficiency of calcium and vitamin D. Now the screening should be done in all women elder than 65 years old, and the symptoms history, no significant history will be there, and white or Asian people, and family history of osteoporosis or fractures, alcohol use, smokers, use of antiepileptic drugs or other drugs like the history of epilepsy, RA, SLE, etc., steroid use and all. And the signs and symptoms mainly vertebral pain, hip pain, radiating to the knee, groin, buttocks and all, and thoracic kyphosis, Dowager's hump, like hunchback, and decrease in height, point tenderness and gait instability. If symptoms and signs of fracture are present, the next diagnosis step will be in osteoporosis, the CBC usually normal. Pancytopenia will be seen in myeloma patients. The CMP will be normal or baseline and low calcium level will be there. And one of the questions asked is like risk of osteoporosis. Risk of osteoporosis includes all except the options given were hypertension, diabetes mellitus, obesity, high animal protein diet and hypothyroidism. The answer is hypothyroidism.